Okay, sorry for the interruption. So, where I was, thyroid gland. Okay, so thyroid gland, if it's antlers, if it's swollen, then you have to tick the antlers, and if it's normal, then you will tick the normal. Okay, then you have to see the range of motion. Range of motion means it's a exercise, like a, if you have to see if the person can move his neck or no. If the person can move his neck, then you'll write that range of motion is present, yes. If the person is not able to move his neck freely, then you will tick the no. Okay, so all these you will assess in the neck. So first you will assess the appearance, second you will assess the lymph nodes, third you will assess the thyroid gland, and the fourth you will assess the range of motion. Okay, this is all about the neck, and then comes to the chest. Clear? You have understood the neck? Okay, then we will come to the chest. Okay, so chest, first what you will see? You will see the shape. Shape of the chest you will see. What are the options you have for the shape of the chest? First you have normal, then barrel, then pectus carinatum, then pectus excavatum. So here you can see the picture. This one is the normal one. Okay, first is this picture is the normal. Then second is barrel chest. So in barrel chest what happens? Chest wall is held in a state of hyperinflation, means the chest wall becomes hyperinflated. Okay, so here you can see the picture. The chest wall is hyperinflated. Okay, so this type of chest is called barrel chest. And the next is third is pectus excavatum. So in the pectus excavatum, what happens here? The sternum is depressed inwards. Okay, so this sternum, it is depressed inwards. Clear? Then in the pectus carinatum, what happens here? The um, sternum turns outward. Okay, it is the opposite of the pectus excavatum. Pectus carinatum is the opposite of the pectus excavatum. Okay, so here you see the normal means normal, barrel means the chest becomes hyperinflated, then pectus excavatum means the sternum is depressed, means sternum turns inward. Okay, and then pectus carinatum means the opposite of the pectus excavatum. So that one you have to see, and after observing everything, you will take the correct option for the shape of the chest. Clear? Then, then next is chest circumference. So chest circumference, how will you assess? You will measure using a measuring tape. Okay, you will measure the chest circumference in the nipple line. After measuring, the after measuring you will write the value. Okay, size of the chest circumference. Then symmetry, you will see if it's symmetrical or not symmetrical. Then respiratory pattern, you will see respiratory pattern normal, then dyspnea, then tachypnea and bradypnea. So normal means normal. Okay, it is the respiratory rate is between 16 to 20. Okay, if the respiratory rate is between 16 to 20, then it's normal. And if there is shortness of breath, then it will be dyspnea. Okay, and tachypnea means if the respiratory rate is more than the normal, means more than the 20-22. If it's like 30-32 like that, then you will write it as tachypnea. Okay, and bradypnea means if the respiratory rate is less than the normal. Okay, so this all these terms you have to remember. Okay, and then you will see what you will write whatever you observe in your patient. Okay, then chest expansion you will write unilateral, bilateral or absent. So how will you assess the chest expansion? So you will place your hand on top of the patient's chest. Okay, and you will ask the patient to inhale and exhale. Then while inhaling and exhaling, what you will see, uh, the expansion of the chest. If the chest expands only in the one side, that means it is unilateral chest expansion. Okay, and if the chest expands equally in both the sides, that means it is bilateral chest expansion. And if there is no any expansion at all, then it is absent. So in the chest expansion, you will write unilateral, bilateral or absent. And the next is heart sounds. So heart sounds, you have four heart sounds. Okay, S1, S2, S3 and S4. So among these four heart sounds, the normal heart sounds are S1 and S2. Okay, then S3 and S4 are abnormal. So for normal heart sounds, you will hear mainly S1 and S2. So how will you assess the heart sound? So here, these are the areas for listening the heart sound. Okay, these are the areas for the auscultation of the heart sound. So S1, where you will hear S1 can be heard best at tricuspid area and mitral valve. So here is the place. This is the area for listening the S sound. Okay, this two means it is in the fifth intercostal space. Okay, and tricuspid area, it is just next to the sternum. Okay, and this is the mitral area. It is also in the fifth intercostal space, but in the midway of the clavicle. Okay, so in these two area, what you will hear? You will hear the S1. Okay, S1 heart sound you will be able to hear in tricuspid area and the mitral area. Okay, then S2 can be heard best at aortic area and pulmonary area. So these two area is the aortic area and the pulmonary area. So in these two area, what you will hear? You will hear the S2. You will hear the S2 best in these two area. Okay, that means in the second intercostal space, that is pulmonary area and aortic area, you will be able to hear the S2 here in this aortic and pulmonary area. Okay, then the S1, the normal heart sound is S1 and S2, which sounds like a lub dub. Okay, the heart sound, it sounds like a lub dub. Okay, and S1 in S1 sounds like a lub, and then S2 sounds like a dub. Okay, so while listening your heart sound in the tricuspid and mitral area, what you will hear? You will hear the S sound louder than the S1 sound louder than the S2 sound. Means you will hear the lub sound louder than the dub sound. Okay, means like lub dub, like that. And if you hear the heart sound in the aortic area and pulmonary area, here you will hear the S2 sound louder than the S1. Okay, means you will hear the dub sound louder than the lub. Okay, so these are the areas for the auscultation of the heart. So I'm going to repeat once. For the heart sounds, we have four sounds: S1, S2, S3, S4. Okay, S4 you will hear best in the which area? In the tricuspid area, in the mitral area. That means it is in the fifth intercostal space. So this is about S1. And S2 you will hear best in the second intercostal space. That means pulmonary area and the aortic area. Okay, clear? Okay, then lung sound. Okay, lung sound, you have normal sound, rales, bronchi and wheezing. Okay, this rales, bronchi and wheezing, all these are abnormal sounds. Okay, so normal sounds, what are the types of normal lung sounds here? So see, lung sounds, normal sounds are vesicular sound, bronchobesicular sound and bronchial sound. So all these are the types of normal sound. So vesicular sound, it is a low pitch sound. Okay, so where you will hear this vesicular sound? You will hear this sound over most of normal lung. Okay, so here you can see in the picture. um, so here in the picture, this is a vesicular sound. So this vesicular sound, it is heard over most of the lung field. Okay, it is a soft and relatively low pitch sound. And then bronchovesicular sound, you will hear this sound in the second intercostal spaces, first and second intercostal spaces next to the sternum and between the scapula. So this sound is the bronchovesicular sound. And the third sound is the bronchial sound. So bronchial sound, where you will hear mostly over the manubrium, just above the clavicle. Okay, then the tracheal sound you will hear above the over the trachea. So these are the types of the normal sounds. Okay, so these sounds, just by observing you won't be able to understand clearly. Okay, that's why I'll be sharing you some videos, means some sounds, normal breath sounds, so you listen to those sounds, then you will be more clear. Okay, then these are the abnormal sounds. So abnormal sounds are like rales, ronchi, then stridor and wheezing. So all these are the abnormal lung sounds. Clear? So normal sounds are bronchial, vesicular and bronchobesicular. These three are the normal sounds. And the abnormal are rales, ronchi, stridor and wheezing. So all these sounds you listen, then you will be able to differentiate what is rales, what is ronchi and what are the normals. So for this I'll be sharing you some YouTube videos, so all of you make sure that you listen to those sounds. Okay, clear? Clear? I'll be sharing you some YouTube videos, so you listen from that video. Okay, because it's not possible to make you listen the sounds here. Okay, so that's why you better listen from the videos which I'll be sharing. So in the chest, what you will observe, first chest, shape of the chest, then size, then symmetry, then respiratory pattern, then chest expansion, then heart sounds and lung sounds. So all this you will assess in the chest. Then next comes the abdomen. So abdomen, so first you will see the shape of the abdomen, normal, abnormal, and then you will see next the size of the abdomen, means abdominal guard. Okay, so size of the abdomen, how will you measure? You will have to measure in the umbilical area. Okay, you have to use a measuring tape and then measure it in the umbilical, above the umbilical. Okay, then you have to, next you will see the any scars like stria gravidarum or linea nigra. So if all these scars are present, then you have to write it as present. So stria gravidarum means like it is present mostly in the women, and it becomes more during the time of the pregnancy. Okay, then linea nigra is also present during the time of the pregnancy. It is a straight line which is present in the abdomen in the time of the pregnancy. Okay, so all this you will assess, and if it's present then you will write present, if it's absent then you will write this absent. Then ascites, you will see if it's present and present, absent and absent. So ascites means it's a accumulation of fluid. Okay, the abdomen becomes enlarged by the accumulation of fluid. So if the abdomen is um, enlarged with the accumulation of fluid, that means the ascites is present. If not, then absent. Then bowel sound, you have to see normal, hyperactive, hyperactive. So bowel sound, how will you listen? So first you will listen in the left upper quadrant, then comes the left lower, comes the first here, then second in the left lower, third in the right upper, and the fourth in the right lower. So this, in this areas you will listen to the vowel sounds. Then the next is palpation of liver. You will palpate the liver. If it's palpable, then palpable. If it's not palpable, then not palpable. So liver, spleen, all this you will palpate. Okay, then next you will see tenderness and palpation. If any tenderness is present and palpation, then you will write present. If no, then okay, no, absent. Then percussion. So percussion sounds are resonance, hyperresonance, dull and tympanic. Okay, so here is the palpation of the liver. So how will you palpate the liver? First you have to place your hand in the right iliac fossa. Okay, and then you will ask the patient to breathe in and out, and then you will, while breathing in and out, you will you will try to palpate the liver. Okay, if it's palpable, then it's okay, it's palpable, you have to write. If it's not palpable, then you will write it as not palpable. So spleen also same process. For palpation of the spleen, you have two technique: first one hand technique and the second two hand technique. So you have to see if it's palpable, then palpable, not then not. But normally the spleen is not palpable. Okay, so these were the um, abdomen. These were all about the abdomen. So first you will see the shape, then size, then scars, ascites, bowel sound, palpation of liver, spleen, then tenderness of palpation, then percussion. So all this you will assess in the abdomen. Then next comes the genitourinary area. So in the genitourinary area, first you will see voids, freely or catheter, means like the way he is passing his urine. That one you have to see if the patient is being having catheterization, then you will write it as catheterized. If the patient can pass the urine freely without any catheterization, then you will write it as freely. Then you will see the color of the urine, amount, and the sediments. Sediments means like any substance, if it's present in the urine, then you will write. If it's no any substance, extra substance is present, then absent. Okay. Then hematuria means the um, passage of blood along with the urine. Okay, if it's present, then present. Absent, then it's absent. Then retention or incontinence you have to see, then you have to tick present or absent. So all these are the things which you will see in the genitourinary area. And the next you will see spine and extremities. So in the appearance you will see lordosis, kyphosis, and scoliosis. So if the patient is like this first picture, then means the patient is healthy. Okay, and the kyphosis means the patient's upper back is a rounded shape. Okay, and in the lordosis what happens, the patient's lower back turns inward. Then in the scoliosis the patient's spine becomes crooked. So all this you will observe, and you have to tick the correct option. Normally the mostly it will be healthy only. In some cases you might find this kyphosis, lordosis, or scoliosis. Okay, so next what you will see, range of motion. Then next you will see muscle tone. In the muscle tone, what we will have, what we will assess, spasticity, flaccidity, and normal. Then sensation you will see normal, impaired, and phantom pain. Okay, so in the next reflexes. So the reflexes, for assessing the reflexes, what you need a tuning fork. Sorry, not tuning fork, reflex hammer. So for assessing the reflexes you need a reflex hammer. So what reflexes you will assess, you will assess the biceps, triceps, and patellar and Achilles. Okay, so these are the deep tendon reflexes. So how to assess the reflexes, I will show you through the video. Okay, I will be sharing you YouTube videos, so you see from there and you will be uh, able to understand. If you can't understand, then you can ask me. Okay, so reflexes, what you will do, um, use the you will use a reflex hammer. Okay, and by that reflex hammer you have to strike on the particular area. Okay, and if after striking, if there is any reaction, if there is any movement, that means the reflexes is normal. If there is no any movement after striking, that means the reflexes are abnormal. So that one I will share you the video. Okay, then clubbing of fingers means like the fingers become in a spoon like. Okay, spoon shape, the fingers become spoon shape. So you have to see if there is, the fingers is like spoon shape, then you'll write as present. If not, then absent. Then nails, you will see spoon shape, brittle, presence of dots or vertical lines. Then you have to see the cleanliness of nails. Then pedal edema, then pitting edema. Okay, so pedal edema means the edema in the lower limb. Okay, then pitting edema means like this picture is the picture of the pitting edema. Means what happens, once you press the skin remains depressed only. Okay, it takes some times to return to the normal. Okay, this is called pitting edema. If it is present, then you will write this yes. If it's not present, then no. So all this you will assess in the spines and extremities. Then next is neurovascular assessment. So here neurovascular assessment. Since long, how long I was inaudible? Okay, so since how long I was inaudible? Okay. Okay, sorry for the inconvenience. Okay. Okay, so in the spine, what you will assess? You will assess the appearance, range of motion, muscle tone, and sensation. Then reflexes, clubbing of fingers, nails, cleanliness, pedal edema, and pitting edema. So all this you will assess in the spine. And then neurovascular assessment here. So neurovascular assessment includes 5 P's. Okay, first is pain. You have to assess pain, pallor, paralysis, pulse, and paresthesia. So pain means you have to see if the patient can feel any pain or no. Then for the pulse, you have to check the pulse rate of the patient. Then pallor. Pallor means like the patient might look dull, or like pallor means like lack of blood. Okay, the patient looks dull. Then paresthesia means some abnormal sensation. Okay, then paralysis. So paralysis means like, mm, how to check the paralysis? You have to ask the patient if he can move his legs, if he can move his hands or no. Okay, so all these 5 P's you have to assess in the neurovascular assessment. So this was all about your physical assessment. Okay, so I'm going to revise once more. First, so in the physical assessment, what you will do, you will assess from the head to toe. Okay, starting from the head to the toe, you will assess. That one is the physical assessment. So first you will assess the general examination, then comes to the head. In the head, you will assess the color, distribution, circumference, all this. Then comes the face. Okay, so in the face, you will assess the shape, symmetry, and in the eyes you will assess the eyebrows, eyelids, eyeballs, conjunctiva, everything. Then next you will assess the ears. Okay, you will have to assess the external ear, then the hearing capacity, then if there is any discharge. So all this you have to assess. Then the nose you will assess the septum of the nose, then appearance, then the hearing capacity. So all these, not hearing capacity, I mean, sorry, then the discharge, then pain and palpation of the sinuses. So all this you will assess in the nose. Then comes the oral cavity, and the oral cavity will assess the teeth, dentures, tongue, everything. Then neck, chest. Okay, then next what comes after chest? Abdomen. After chest, abdomen. Then after abdomen, genitourinary area, then spine and extremities, and the neurovascular assessment. So each each part you have to assess properly, starting from the head to the toe. Okay, that is the physical assessment. Clear? Then about the assessing the biceps and the about the hearing to the lung sounds, I'll be sharing you videos, so you listen to those videos or you watch those videos. Clear? Then the types of the assessment. Okay, types of the assessment. What are the types of the assessment? Means first, admission assessment means any assessment which is done at the time of the admission of the patient is called the admission assessment. Okay, and then the safe assessment means like the assessment which is done during every shift is called shift assessment. Then the focus assessment means a detailed assessment of the specific body system like respiratory system or digestive system. Any specifically done to any system is called the focused assessment. So these are the types of the assessment. Clear? So from the topic health assessment, we have completed definition. Okay, purposes we have completed. Then process, definition you have completed, purposes, then process. Okay, process, here we have two steps. How to assess the health assessment? We have two steps. First is health history and the second is physical examination. These are the two steps for assessing the health assessment. Okay, health history, you will, in the health history, it includes first biography information, then chip complaint, present health status, past history of illness, then family history, personal history, socioeconomic history. So all this comes under the health history. So all this you have to assess. Then in the physical examination you have to assess the patient from the head to the toe. Okay, this is all about the health assessment. Clear? Have you all understood? Actually this topic is mainly based on the practical. Okay, it would be better if you could learn this topic through offline classes, through the lab. So I think you all have understood at least something, right? Can you hear me? Okay, so today I have concluded this health assessment topic. Okay, this is my last class. Then if you have any doubt, then you can ask me. Okay, so this PDF I'll be sharing you in the WhatsApp. So all of you make sure that you write the notes. Okay. Okay, how was your exam? Good. Okay. So, okay, maybe you will get within a week, maybe in the next week. Okay, so we have completed this health assessment topic. Okay, health assessment is nothing, it's just a assessment of the patient's body. Okay, it's a assessment of the patient's health. That is the health assessment. Clear? 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 Okay, so you send me the attendance, okay? One of you send me the attendance, or you can send individually also in the group. Okay, then if you don't have any doubts, then I'll end the class now. Okay? Okay, thank you.